good afternoon, for some people, good evening, for some people, good morning, wherever you are. Thank you for taking the time to join me today. This is a follow-up in some level to the spring detox lecture webinar, and today really we're going to take question and answers. And a lot of you submitted the questions already after last month's webinar on detox. We literally had hundreds of questions, and I had the opportunity to go over them already and select very important ones that I felt really can benefit many people. There are a lot of questions about products, especially about Pectasol. And so I will address it. I mean, it's an important part of my life. I don't know if I shared, but I actually sold Econogenics. I'm no longer the owner of Econogenics, but I'm proud of this product and delighted because they're helping so many people, and I'll be happy to clarify. But before starting, I really want to emphasize that detox is really beyond just a cleanse or beyond helping a certain system in the body. It's really what we spend the majority of our time doing every time we exhale. Every cell in our body spends time doing it. And it has a physical, biochemical component, but it also has an emotional component, a psychological component, a mind component, a spiritual component. And in principle, the more you use matter, substance, like a supplement, the more direct it is, the more the message can maybe affect on the cellular level, but also the more crude it is. Won't be very easy for this to penetrate the more refined level of detoxification. The detoxification is a process of letting go. And because once we truly let go, then really sky's the limit. That's really where we touch our infinite healing potential. From letting go of toxins on a physical level and heavy metals and mycotoxins, to detoxifying from side effects of treatments, to detoxifying certain symptoms from diseases, through detoxifying bad experiences and emotional stuckness that we encounter this life, through letting go of patterns that are multi-generational, genetic and epigenetic in their nature. So all of this is detoxification. And there are really three basic doors. I talked about it more in my one-day Zoom meditation in healing open heart medicine retreat in January. There's the door of the body. There's the door of the speech, of the energy, of expression, not manifestation, which is the substance, but expression, movement. And there's the door of the mind. And the higher the door, the mind controlled the speech and the form, and the speech affects the mind and affects the form. The form can also affect the mind, and we feel better, when we physically function better, when our mitochondria function better, we're in a better mood, and our mind gets affected. So there's, of course, it's a dialogue, it's a dynamic process, but we don't want to overlook any of it, and we want to understand that detoxification is beyond just what supplements to take. And with this, one of the questions that reflected is a very good question. I'll read it out loud. Would you please explain how emotional and physical trauma cause detoxification difficulty? And then the person already answered it. Is it that when we are perpetually in fight or flight, blood isn't sufficient flowing to organs and don't contribute to escaping danger, real or imagined? Thank you. So the reason I feel it's an important priority, because it encompasses a bigger picture, a bigger understanding of detoxification. And again, I will talk much more about it next month when I will talk specifically how to use meditation as a way to detoxify, to let go of traumas. So in this sense, basically, when we have emotional and physical trauma, for us to recognize the trauma, that already happened, right? Otherwise, it wouldn't be a trauma. It means that while we are present, while the present time is right now, our body is dealing with something that happened in the past. It can be a physical trauma like an injury. It can be a physical trauma like a heavy metal or a toxin exposure or a drug side effect. It still creates a physical effect on us. And it can, and of course, this is part of where we accumulated this in our life, and part of, for example, babies of mothers who were alcoholic, right? Fetal alcohol syndrome, or women who smoked, or you lived in an area that was high toxicity when your mother was pregnant. And of course, it goes back to what happened genetically and what families goes in the family and what epigenetic traits have come. All of this affect our cellular function. And when our cellular function feels that it's not balanced, it doesn't have the spaciousness, openness that really is the goal of detoxification. Because the more we let go, the more spacious we are. Why? We physically create space, like we clean the junk. So the more we are tied to past events, then first on a cellular level, the cell is caught, or the tissue or the organ or the body is caught in a reality that is no longer here. So a lot of energy is consumed, and there is a holding. There is really a holding to the past. Often in meditation, they say, let go of the past. Don't hold to the past. So we hold to the past from our experiences, from our thoughts. But what really holds us to the past is traumas. And it's not the time for, when they have like dozens of questions, but it doesn't mean you can never think about the past. Right? If you look, for example, in ceremony, in different traditions, they often look at the past, but they are present at the moment. So if we are present at the moment and we just project into the past, we can clear the past. That's what different ceremonies do. Clearing of energy, right? But if we are caught in the past, we simply have less energy for the present. And detoxifying becomes difficult. I remember I had a certain patient many years ago, almost 30 years ago, and this person came in. And first they said that, they came in and they told me, Isaac, you remind me of my uncle from 30 years ago. So their first interaction with me is I reminded them of somebody from the past. And then you could see how their behavior is based on their past experiences. And they basically had severe chronic fatigue and fibromyalgia because they had no energy to be in the present. They couldn't detoxify their emotions. So there's a very special acupuncture treatment where you basically, instead of trying to fix, you just detoxify the past experiences by detoxifying the energy channel, and you rebuild a new channel. And it was really interesting. It doesn't always happen, but it was a one treatment turning around healing, because this person simply, the acupuncture was able to have the person let go of the past, and now the energy was in the present. It was remarkable. They said, I'm not interested anymore in talking about the past, and they suddenly have a lot of energy. So in this sense, trauma creates stuckness, and physical trauma often creates a scar. And the scar, a traumatic scar, always goes in a loop. It never releases. And in the same way, a physical scar. So the scar often uses galectin-3, for example, to create isolation. It uses chronic or ongoing inflammation to try to heal. And of course, in this environment, there is less blood supply, there's less oxygen. So the strategy is to clear the area, always detox, and then to bring nourishment for transforming the area. So that's a very, very good question. And it's important for us to the reason why I opened with it, because it's really part of an authentic detox experience. The next question that I was asked is, do you do a therapeutic plasma exchange? And if so, if you only have one good vein, do you have expert in ultrasound to find another? So first of all, I'm intrigued that somebody asked if you do therapeutic plasma exchange. And the reason is that what I specialize in is therapeutic aphaeresis, which is very different, is what you actually filter the plasma. You don't throw it out. You just filter it from toxic stuff that is fat soluble specifically. So LDL, low density lipoprotein, LDLP, small particles, all the bad particles of cholesterol, lipoprotein A, fibrinogen, a lot of growth factors. And then what happens at the end of a treatment, and you do more than one plasma of filtration, between 1.2 and 2, depending, so your whole blood circulates twice, then the person is cleaner. And then it allows the tissues to let go. I don't know if you remember from last time that we talked that if we let go of the stuff in the tissues and we are not able to handle it in the blood, we'll get side effects. So that's the power of aphaeresis, is that there's a machine that cleans up the mess. Plasma exchange is when you take the plasma, you throw it out, and you replace it with fluids, with albumin, and with basic electrolytes. So it's an important procedure. It's used, traditionally it was used in hospitals only. In the last few years, really few years only, some integrative clinics are doing it in the clinics. It's unusual. A full plasma exchange is much higher risk than therapeutic aphaeresis. But I think they're doing limited volumes. And so far, so good, or no? And the issue with plasma exchange is that you're also losing a lot of what you need. Now, if you have an autoimmune disease and you want to get rid of immunoglobulins, that's a great way to do it. That's why in many autoimmune conditions or graft versus host, when somebody had a transplant and the transplant is attacking the body, and you will use this treatment. And in other autoimmune conditions like Guillain-Barré, these are the classical ones. So it's different. And yeah, the most important thing in plasma exchange is to have, in therapeutic aphaeresis, is to have one really good vein. The return vein is usually much easier to find. Okay. I'll keep on going. And I'll also look at some new questions to see. Let me see. Okay, so some of the people, some of the questions I'll repeat. You already sent them to me. That's great. So somebody asked me if I still do retreats. Yes, definitely. I don't know where is this question from. So this is my passion. That's what I love to do. I love to share. I'm trained in meditation and healing for decades. And it really ties into the process of detoxification. And so for many years, I taught mainly in Israel, 2 long retreats face-to-face a year. Now I'm not doing it anymore there in an active way. And I offered a free Zoom retreat here in January. And now I know we are offering it to people. It's a powerful day. And I am doing my first in-person retreat in Hawaii in September of 2024. I'm very excited because I'm bringing people to my home, to the place where I spend many months a year, and the place where I go to swim, the place where I meditate, the place where a lot of my creativity and insights come. So I feel like I'm inviting people into my home, into my heart, into manifestation of my heart. And somebody asked me, I don't remember where is the question, if we do detox in retreat. And that's a great question. So in principle, just going to retreat starts a detox process. Why? Because we are leaving our regular environment. And when you leave your regular environment, you leave some of your habits. You know, they say you come home as an adult, you knock on the door on your parent, you visit your parents, you knock on the door, you are 15 years old, your mother opens, you are 10 years old, you give her a hug, you're 5 years old, you know, right? You go back. People know this experience. So the first step in a spiritual journey, in a journey to change things, is changing the environment. And then being in an environment that is in nature. That's the advantage of doing it in nature compared to doing it in a big hall. Now, in a big hall, it's still surprisingly powerful, but there's something about being in nature that really potentiates it. And then within it, we use dietary regimens, so lighter food, plant-based, gluten-free. We use qigong, yoga, breathing exercises, and we use a lot of meditation that are focused on creating spaciousness in our being, because to detoxify, you need space, on letting go, and on connecting with the next evolution of detoxification, the transformative power of the heart. And because the basis of open heart medicine is connecting with the ever-going flow of the heart, naturally, when we're in the flow, there's no stuckness. And when there's no stuckness, everything that needs to be detoxified can be detoxified. So that's a little bit about the retreat. I had a lot of questions about products and a lot of questions about Pectasol, probably dozens of questions. So maybe I will answer, I'll talk a little bit about Pectasol in general, just because there are so many questions. Even if it wasn't my plan, I want to respect the high percentage of people who had questions about it. So basically, Pectasol is a modified pectin. Pectin is a long chain of carbohydrate, of sugars, not glucose, galacturonic acid with side chains, and it's being cut to a smaller size so it can get absorbed into the bloodstream. So initially, we thought that you have to really separate Pectasol from any food or supplement by an hour before meal and 2 hours after, but it's not necessary. It's enough to take it 15, 20 minutes before meal or an hour after. Best times are early morning and late night. And you can take it with other supplement. It gets broken, it gets absorbed, so it's not going to interfere. I think that thyroid medications, there's this emphasis on thyroid medication being taken in an isolated way. So a good idea for people who take thyroid medication, when you start your day, you take thyroid first. And then remember, if your stomach is really, really empty, the small thyroid grain will break in 2-3 minutes and start getting absorbed. So from my conceptual perspective, if you wait only 10-15 minutes, it's still going to, it's going to take another 5-10 minutes until whatever you took is going to reach where the thyroid was at the time when you took it, and it's all moving forward. So even 10-15 minutes can make a difference. So there is no need. You can put Pectasol in fluids. You can put it in hot water. It actually, the way to dissolve it is you put the Pectasol in the cup. And now there are some shakers. I know Econogenics. I mean, I didn't get it, but I saw that I think they have these spinners, so it's easier, or in a cup that you can shake. But otherwise, you put it in a regular cup, you add tiny bit of regular water, like literally like half an inch. And then you add about 1.5 inches of hot water. And you don't touch it for like 3-4 minutes. And then it will just absorb the water. And then you mix it well, you put regular temperature water, and you can drink it. You can add the mushroom mix. You can even add green products if you want. You can add eco-probiotic if you use the probiotic that I like. You can use other probiotics. It's okay. Somebody asked about using Pectasol with coffee. I am not sure it's a good idea. I've never tried it, but it's a little bit, there's some counterintuitive. It's one of the questions from today. concepts about taking it together. So Pectasol is a basis, and the reason is because from a detoxification point, it was proven to remove heavy metals. It also has some binding capacity. So it's proven, we actually published on it. It has some binding capacity to certain mycotoxins. And different than other binders, when binders bind and pull stuff out of a tissue or out of the gut lining, there can be a reaction. Pectasol, by breaking down the galectin-3 lattice formation, the galectin-3 coating that is made out of 5 galectin-3s that attach to each other, actually reduces inflammation and allows more blood to get to the tissue. And that's why with Pectasol, you don't get the same inflammatory response that you often get with binders. So that's really a flag product. Like if you had to take one product, take Pectasol, and it's unrelated to how you feel. It's unrelated to if you feel a difference. Because even if you don't feel a difference, it's doing its work in blocking galectin-3. And Pectasol will be beneficial regardless of your level of galectin-3. So that's a little bit about Pectasol. So somebody asked a really good question. They asked, do you recommend liver detox prior to gut colon detox? Which should go first? That's a great question. So that's where we talk about the emphasis between spring cleanse and fall cleanse. And there's somebody from Australia who asked the question, what about us? We are now in fall cleanse. So in fall cleanse, the emphasis is the lungs, like letting go of the grief, letting go of things that we are holding from the past, from the whole year, before we move internally into the winter, into longer nights. And the coupled with the lungs is the large intestine. So eliminating stuff that we are holding to. So when you do detoxification, you want to support the ability of the gut to get exposed to the toxins that are now coming to it at a greater level through the bile, and the gut being able to flush them out, to eliminate them without creating a reabsorption or an inflammatory response in the gut. So in this sense, the gut has to be involved. But the main engine of detoxification, especially in the spring, is the liver. So you want to support the liver, both by supporting phase 1, and we have the slides from last time. You can look at the presentation. I don't want to repeat. And then certain cofactors. And you want to support, so phase 1, when now the liver bound different insoluble toxins and made them more obvious to the body. So there's also an aggravation because they are more active. And then phase 2, when the body binds to them, conjugate in order to eliminate them. So you always want to make sure you have enough of phase 2, otherwise phase 1 will work too fast and you'll get side effects. So first you want to help the engine. And then you want to make sure that the gut can support it. So these come together, and they're really not in different phases, but you don't want to push too strong of a liver flush. For example, there are certain liver flushes that people do with different recipes. And you don't want to, like, if you are planning to do colonics and really clean the colon, don't do it right away. Do it like first, give yourself a few days that you're going into the cleansing process. You let the process happen organically. And then it has to be a balance between these two organs when you have in mind which organ is my weak organ. And your weak organ is the organ that's having a hard time functioning. So a weak organ is a weak organ from the point of view of the symptoms it demonstrates. Very important. Often your weak organ is your strongest organ. And because it's the strongest organ, you are overusing it in your life, right? Because we use what we are strong at. So let's say that you are 50 years old, but you can have a liver that is 80 years old. And you can have a colon that is 70 years old, and a kidney that's only 40 years old. Actually, different organs age at different levels based on how much we use them. We use them physiologically, also how much we use them mentally and emotionally. And that's the beauty of Chinese medicine. So the detox cycle is present in every organ in the body. So there are small cycles that happen all the time, and there are bigger cycles that sometimes last a few years. And it's hard to do, but in the pulse, you can see which organ is just finishing its cycle and ready to restart. And often you will catch a ride on this organ. I'm a little bit complicating it, but I just want to give you a flavor of the potential, of the complexity. And that's why we also want to time the detox in time that the world is detoxifying. So late March, early April, like the Hawaii retreat is right around the fall equinox, you know? So we're just moving into the winter season. The body is getting into the fall season. The body is ready to let go. So a planned detox that is not related to a disease is best done in the changing season. And one of the best things to connect the liver gallbladder with the gut is a lemon olive oil drink. One, because it's very mild. And so you can use it over weeks, over months even. And two, it addresses the liver gallbladder, the sour taste that is the taste of the liver gallbladder in Chinese medicine, and produces cholecystokinin, one of the enzymes that has to be excreted by the pancreas, and the oil that, of course, get the gallbladder working because we need to absorb oils. So you get the liver gallbladder flushing in, and then you get the pectin, the high molecular weight pectin, it's not modified, and the nutrients and the bioflavonoids in the lemon, you get them to absorb the stuff that you're getting rid of in the large intestine, in the gut, in the small intestine, so they don't get reabsorbed. And you can eliminate them, and you get less of an inflammation because of the effects of pectin and bioflavonoids. So you can see the liver, large intestine connection. And then there was a question, do I do a lemon olive oil in the morning or do I do it at night? So I'm going to give you, today I didn't plan, but I'm going to give you a little bit more in-depth answers on everything. It's my mood today, so I apologize, but maybe that's why you're coming and listening. So principle, you do it at night because then you got the whole night for the mixture to work. And it also can help you sleep. People sleep better afterwards. But if you think about it, when you do it at night, and let's say you do it at 10 p.m., 11 to 1 is the hours of the gallbladder. So you're going into the gallbladder becoming most effective. Gallbladder is the first organ in the 24-hour clock. First organ in the 12 signs of astrology. Okay, so it says a lot. It's where things start. And then it moves from 1 to 3 into the liver. And then at 3, guess where it goes? It goes to the lungs, and 3 to 5, and to the large intestine. To exhaling through the lungs, and to letting go through the colon. You see the wisdom, right? Also, inside the liver and gallbladder, we process, we do our inner process of detoxification, and then we wake up and we exhale out and we eliminate in the morning. So you can see the discharge and elimination built into this in a very wise way that is unfortunately very rarely mentioned when you talk about Chinese medicine. So if you do it at night, you're emphasizing the liver, supporting the gut. But if your real issue is the gut, that you know the gut toxin and the gut is not going to be able to handle them, then you do it in the morning. Because then now you're helping, because it's the gut hours, the liver is at a low point, but it's still a little bit making the liver wake up and dump stuff. So that's the time of the day can shift you between the emphasis. Ideally, you do this in the spring and the fall, and you can do the lemon and olive oil for 1 week, 2 weeks. I often recommend for 3 weeks. But I used to go on retreat in the winter. This was my free time. And interesting why, I guess, for whatever reason. So I would go to very cold areas, and I would be for many years, for 20 years. And I would be in a cabin that had no electricity. So I would literally get a supply of lemons, organic lemons. I would chip the tops, cut them. I had like flashlight and stuff, and heater was wood stove because there was snow outside. I would cut the lemon, okay, or use the whole lemon actually. And I remember cut it to half. I think I used to use the whole lemon, and I would use a grate, and I would just grate the lemons. Obviously, I'm not going to have refined lemon like you do in a blender. It was some of it had pieces, and I would add the water and the olive oil mix, and I would drink it. And so for me, I did it in the winter. It wasn't on one level ideal, but I was going through a detox process. So I timed my time and my inner process with this. And for example, for me personally, I used to do something called a autosanguine therapy. I used to do it a lot in the clinic. I don't do it as much because the remedies are not as available. Where you take a drop of blood and you add one remedy mixture of heal. Let's say lymphomyosalt is one I really like because same logic. You start by cleaning the lymph system, cleaning the stuff that just came out of the cells, and you succuss it, and then you take one drop of this and you add fluid, and you add the next remedy. So I had a certain sequence that. So I would start with the lymph, then I would help the liver, then I would give, then I would help the kidney bladder. So what I would do is I would do the basic thing, cleaning the lymph, helping the liver get rid of the toxins, and then helping the bladder eliminate it because I'm using blood, it's in the circulation. And then I would use another remedy to help the metabolic process, all the metabolic factors, ubiquinone compositum. And sometimes, if somebody had a deep infection, I would add tonsilla, which is a very deep remedy in heal that goes through all the layers, either in the beginning, before the lymph, or after the lymph, between the liver, depending on the patient. You could see how, with a treatment, I would create all these layers, and I would inject in different points, different acupuncture points. So why am I telling you this? Because I remember one retreat, I decided to really do it. So for 6 weeks, every day I would prick myself and do these injections to myself until I remember one day, I woke up in the morning, I was still in retreat for another 2-3 weeks, and I just said, okay, I'm done. The process is simply over. And that's it, it was over. So I had enough time, and I was in a contemplative mode, and I wasn't seeing anyone for many weeks, except for a phone call that somebody will bring a phone, and I will write messages that will go to the clinic and to the family every 3 weeks. So a little bit radical, you know, I don't know if I would do it again, but this was my detox, and I would come out of it, you know, looking 15, 20 years younger and feeling amazing, and it was remarkable. So we tried to imitate it in a simpler way. And what I found out that when you do retreats, even a few days, but we have this winning recipe of exercises and lectures and meditation and food, we get in a few days what takes sometimes weeks and weeks or months even when you're doing it on your own. So this is a little bit about this question because it's a good question and it's not so simple. Okay, so we already, so the other question, we answered the retreat part, but they asked how many days do you need to detox, and do your retreat do detox? So talking about how many days, you choose how many days. You can do a detox one day, you know, or you can decide you're doing a detox for a week. You want to define the time that you want to do the detox. You want to have just like we talked, the preparatory phase, the detox phase, and the coming out phase. And we do the same thing in retreat. For example, now why retreat? We cover for people to come the day before. And then there's a special offer for people who want the hotel offers, and we arrange for people who want to stay 1 or 2 or 3 more days. So why are we doing it? This is a preparatory phase. You're now in a different set of mind. You don't come and right away you start it. And when it ends, you give yourself a buffer. You are now already interacting with other people. You're having meals with other people, but you're still in the environment, and we're still, for example, not formal part of the retreat. I'm going to meditate with everybody the night after the retreat finishes and the next morning. So there's another 24 hours, and this is the coming out of retreat. So it's very important when you do detox, no matter where you're doing it, that you allow yourself a preparatory phase. In the preparatory phase, also you decide what you want to get rid of, like the first question about physical or emotional trauma. Okay, and one of the big things with trauma is sometimes even letting go of the concept of trauma. Let's say that often we can be very upset at ourselves why we reacted in a certain way in the past. And so we'll talk about it next time, but just in the context of detox, the body will always do the best it can to survive. And at that moment, for you or for your previous generation, it was the best they could do. Letting go of the trauma is recognizing that whatever happened was a pro-symptom, was what was the best thing you could have done, and that you no longer need it. And mentally, when you recognize it, something in your neurology changes, and then the meditation is what creates the letting go. Without the meditation, there's a moment of aha that lasts for 2-3 hours, and then you're back with yourself. If the meditation is opened enough, there can be a profound, irreversible letting go, because the pattern is letting go of, the scar is letting go of. And wow, the next question totally comes into play with what I was talking. The next question is, how do you prevent reabsorption? So we prevent reabsorption by using binders in the gut that prevent us absorbing the toxins. So that's, for example, why we do the lemon olive oil drink. We don't just want to contract the liver, we want to have something in the gut that will catch it. We want to support the kidney elimination. So, for example, I mentioned I have a detox tincture that I prepare in the clinic from different heal remedies, and one of them is Solidago compositum. I help the kidneys to keep eliminating. There is discharge, letting go from the tissue, phase 1, phase 2, that's the liver roll, and there is elimination. From a psychological, emotionally, psycho-spiritual perspective, it's about the letting go. And the letting go is part of the process of exhalation. And the exhalation is naturally twice as long as the inhalation. So when we do the letting go, and for example, if any of you participated in the meditation retreats, you will find small comments that have profound health benefits. I say, after you exhale, there is a moment before the inhalation comes when there's no movement and you can let go. The more we can stay in this place without just pushing what's happening away, the more the letting go gets established and there is less of reabsorption. If we right away inhale it back, even with the air, even with the concept, even with skepticism, we are canceling the revelation. That's really why meditation puts a spin on detox. It puts it in a different place. And then all the other stuff is auxiliary, supportive. But what you can reach out of it is much bigger. Because when you detoxify, you are breaking tissues, right? You are letting go, and you're eating less, and you are eliminating. If you break tissues, the tissues were made from certain materials that you absorbed at some point in your life. And while you absorb these materials, in the same time, you absorb certain life experiences, great life experiences, and you'll get amazing insights. And bad life experience and bad memories and dreams and traumas will come up. Our job is to eliminate them by supporting the gut, by supporting the breath, by doing infrared sauna for the people who asked, but infrared sauna also pushes from the tissue to the bloodstream. So working with the breath, and by whoever is interested in meditation, not getting caught in the state of focused meditation, of just calming meditation. Calming meditation creates space between events so we can handle better our reality. When we lose the focus and the calmness, which eventually we will, we are back to where we were. There is some benefit. True meditation is when spaciousness, where activity and inactivity becomes the same. When we start connecting, it's not easy. It's really an on-off, and for many people, it will never happen, unfortunately, in this life, even if they do meditation. When we come to this unchangeable place, that they say in Buddhism, in this highest level of teaching, is unborn, never had a beginning, and it will never end. But it's always there, like a flow of a river. When we connect with it, then there is no reabsorption. Physiologically, which organ does it? Only the heart. The heart has no boundary when the blood comes in, like the blood comes to a cell. The heart accepts, and as it needs to take dirty blood to give clean blood. I know I'm repeating it, but every time in different angles. So what it does, it transforms. It uses the wood for fire, right? Creating a transformation as a detox of what the organ wanted to get rid of. Because when we transform, we clearly create authentic detox. When we just cleanse and we still produce the same toxin, then it's a vicious cycle. So I wanted to a little bit more emphasize this because I think it's important. Well, I'm having fun and time is going by, so I apologize. There's one question if ozone therapy is a good way to detox. Ozone therapy is, the strength of ozone therapy is not in detoxification. It can create vitality in the tissue that can normalize the metabolic function and help us then to clean the tissue, but it's not a direct detox. Ozone can help to fight infections, and in this sense, it can help, but it also will create byproducts, from the killing. And that's why very good follow-up for ozone is vitamin C IV. But you don't want to do classically at least glutathione right away because it will counteract the oxidative effect. So people ask about how many days in a row can you do the lemon olive oil drink? And the answer is as many as you want. There are people who do it for many months. I already answered the question from Australia, what element organs are governing the autumn detox? Briefly, but guess what? We'll talk about it in the fall. And of course, whoever can come in the retreat. Suggestion about eliminating glyphosate. So glyphosate is a great question because glyphosate is really the most prevalent toxin that we are facing. And in some level, United States in general has accepted glyphosate. We were brainwashed enough to accept that glyphosate is part of reality. It's kind of insane that we allow toxic stuff to be part of our environment. So I've yet to see one person that has no glyphosate in their urine. I've never seen a person, but there are different levels. So the nasty thing about glyphosate is that it's water soluble. So in the environment, for example, if a field is sprayed, it can travel in a flat area 10, 15 miles. So you can have an organic field, and even on the next field, but 3, 4 miles away from you, especially if it's up the hill, can be far away even, somebody uses glyphosate, and sure enough, you're going to find it. Also, glyphosate prevalence changes based on the season, based on when they are spraying. And glyphosate adversely affects the gut lining for people who asked about leaky gut. So you want to address glyphosate. And glyphosate, just like it addresses the gut barrier, it also disrupts the blood-brain barrier. And just like it creates absorption issues in the gut and creates inflammation in the gut, it will create inflammation in the brain, in the microglia. it will move the brain into an excitatory phase. And because it's water soluble, it's eliminated in the kidneys. People who live in high glyphosate areas geographically have much more higher level of chronic kidney disease, one of the most underlooked conditions, 17% of the population. I do a lot of work with kidney disease, with acute kidney injury as part of sepsis. So specifically Glyphosate, which I developed, and we did some research. We had 12 cases that showed clearly efficacy. Right now, I'm not involved anymore, so I don't know if the study will be carried on or not. That's part of life. So what we do there is we use different compounds from different kingdoms that glyphosate affects. So we use from the soil, we use shilajit and fulvic acid. From the sea, we use alginate and kelp. From the plant kingdom, we use regular pectin. And then we use glycine, because glycine is very similar in structure to glyphosate, and glycine helps detoxification. So people who take glyphosate, sometimes some of them will react more, and sometimes not. Like doesn't do anything to me. And the level of organic iodine in the glyphosate is low. We specifically picked kelp with low levels. And some people who are very sensitive will react. But then usually they will tolerate it. But the Glyphosate with Pectasol is a great combination, especially for neuroinflammation. Now, a word for people with muscle activation, with multiple chemical sensitivity, MCS. So we have an objective response physiologically that many of you experience. And as a result, we have a mind response, an anticipation for something to happen. And that's the biggest challenge of people in this category, is to be able to detoxify the concept and the belief that they are going to react. And it's a very hard task to get people to do for this category and for people who identify with Lyme disease that often have gut issues. So for this category of people, the detox is letting go of the concept that you are going to have an issue. Because if they say, no, what are you talking about? It happened to me 20 times already. Well, it means that you are going to the past and you are holding to a pattern every time. And naturally, if you go through a certain highway and you just passed one town and you know which town is the next one, you're going to get it. So basically, by holding to a concept, you are eliminating your possibilities, which is contrary to the basic principle of open heart medicine and defeats the purpose of detoxification. And the other part for people in this category is you can have some symptoms, but you can also have a lot of benefits. So you want to weigh in the response, the reaction, and the benefit. So you want to do it in a careful way, of course, but it's a key issue. It breaks my heart because it limits the healing of the patient. And there is a lot of attachment in the health provider that knows the patient has it and believes that they have it and is expecting them to have a problem. And there's this symbiotic relationship where the patient comes, the doctor treats. It's a vicious cycle, right? Needs to be detoxified. So in more esoteric Chinese medicine, we do it by not labeling a condition. For example, somebody asked me in Chinese medicine a question about what do you do if you have spleen qi deficiency, if your digestive system is weak. So I like it. Exactly. I'm going to move to this one now because it will tie into this. Dr. Eliaz, from a Chinese medicine perspective, how do you support patients with constitutional spleen qi deficiency during a detox? These patients often have psychological imbalances, Renmai deficiency, attachment tendencies. Right? We just talked about it, interesting. Will cause them to feel deficient and resort to overeating or physiologically producing more phlegm after the detox to compensate. So it's a wow question. Somebody really knows Chinese medicine, because when you use a term like spleen qi deficiency, it's like lack of energy of the digestive system, of the pancreas, okay? Of the digestive system. So the system is slowly, so you easily bloat, you feel tired after you eat, you can have some gas, you can have some soft stool, you can have a lot of wet, the stools are wet, and you can feel tiredness in your limb, and you can feel fog in your head, right? When you detox, and you lose it, and what happens often, there is not enough digestive fire. There's not enough energy in the digestion to move it. And the digestive fire in Tibetan medicine, for example, is considered one of the forces of life, the force of life of the digestion, the prana of the digestion, digestive lung. And there are formulas that help to warm up this energy. So, for example, spices do this. Cardamom does it, pepper does it, curcumin does it, ginger really does it, okay? It warms the digestion, you can feel. It gives energy. So for these people, they need to warm their digestion while they are doing it. So for example, one formula I don't use enough, but people got great benefit, is integrative digestive formula that I developed. So it was based on a Tibetan formula, but the Tibetan formula, because it brings heat over time, will create heat that can come up, like reflux and heartburn. So I created with this a movement downward, a normal movement of the digestion, and I put very small amount of digestive enzyme. Why a small amount? Because I want the body to do some of the work. Okay, I don't want to, so in medicine, there's the principle. You replace as much as you can, as much as you need, and from the replacement, which means the patient is here, the doctor is here, okay? So I'm going all the way to the patient. And then slowly I start pulling back, letting the patient do the work until they don't need me. That's a real healing, okay? That's the value of meditation. You learn a tool to heal yourself, okay? It's really neat. I just learned this system called block therapy, fluid isometrics. It's kind of similar principle. What a therapist will do with their hands, you can do on your own. So the little bit of digestive enzymes doesn't take them all the way to here, but only to here. They have to do some of the work. So that's the principle. So, but you will need to give some warming herbs. And the attachment is because of the stickiness. And the stickiness is a property of phlegm. You know, there are three basic fluid, right? In Ayurvedic medicine, in Tibetan medicine, and in Chinese medicine, it's more the quality of phlegm. It's not as emphasized in the same way. And phlegm, if anybody saw it, is very sticky. Even that's of phlegm, all of us saw phlegm, it's sticky. You know, it's not clear. It's sticky, so it sticks. So you have attachment tendencies. And then the more tired you are, the more you try to hold and survive, the more you hold more. The moment the renmai, the middle line, gets opened, everything flows. That's why a lot of spiritual practices, a lot of breathing practices uses the renmai as a way to create flow. And we work on it a lot in the retreat, a lot. Using physical form, I think I did it even in the retreat, using visualizations, and using sound that I didn't do on Zoom, but will be a big part of the retreat. Sounds that help the organs, and sounds to help us recognize the impermanent quality in form, in movement, and in the mind. That's like the doors to what somebody will call liberation, to recognition of our true nature, where healing can happen spontaneously. So this question has a lot of component. I don't know the person who how much they are familiar with meditation, but it's a great question, really. I mean, yeah, this person is welcome to send, to give. I would want to know who is this person, because it's a very smart. So when they say spleen qi deficiency, they are quantifying the issue, right? They are putting it in a box. You have diabetes, you have spleen qi deficiency. You will never see in my notes in the last 20 years writing the patient has spleen qi deficiency. I'm interested in the movement, more about what do you do with patients that their journey is that their inner connection is not flowing well, and as a result, they take a side road and they get stuck in the road. That's their pattern. How can I put them back into their central line? So you try to move away from judging that something is deficient or something is excessive to just describing the pattern. And every pattern will have strengths, and every pattern will have weakness. And every pattern will have multiple stations. So you can alleviate the pattern. Detox does it often, or you can really transform the pattern. That's a transformative quality. That's why meditation is so important. Well, I don't want to move now to more simple questions, but people had them. People asked if SOD or glutathione are very good for detox. Absolutely. Superoxide dismutase is very good for detox. And there was a question, are food detox baths legitimate? Great question. I had them in the clinic 20 years ago. So they definitely change color, but they will also change color if you don't put anything inside, any food inside, because of the electrical current and the different electrolytes. There is something about changing the charge in the feet that allows transition through the skin. There is logic to it, you know. We know that medications can penetrate through the skin. So if you put a certain charge, then heavy charge, heavy metals, and other things that are charged can come out. So there is a logic to it, and some people feel a difference. I mean, when I did it many, many years ago, I felt a difference. But to tell you how real it is, I don't have a good answer. There was a question about, is steam sauna as good as infrared? So it's interesting. I didn't have time to look at research. Infrared is very popular because there is a light component. Steam sauna is interesting because it moisturizes us. So if you have a lot of dryness, if you live in a dry, hot area, or in a dry area, there's a quality about steam sauna that allows moisture to come into the body. And often in steam saunas, they will put certain essential oils. So I've been playing around with it in my last, stay in Hawaii now. It was too short, about 2 weeks, but I'm going to play with it again now if I can for 3-4 weeks. I want to feel how it feels when I'm outside. I swim in the ocean. I just meditate in the sun, and then I do the steam. So I think there's something beneficial about the steam sauna. It's more complicated to have it compared to red light therapy or infrared, but there is value to it. But it's interesting how such traditional Scandinavian treatments like saunas and cold baths that have been done for millennia are now making an entrance into mainstream, and it's really fascinating. So, wow, it's 5 o'clock, and I think, oh my gosh, well, yeah, there are a lot of questions. Let me just see.
Isaac, can I ask you a quick question?
Of course.
People want to know what the combination is, what the ratio for your olive oil lemon drink is in the evening.
Okay, so there is a recipe in my book. So not to talk about the survival paradox, but maybe I should. And so the survival paradox really offers you a roadmap. It offers you a new paradigm. But once you are done with the paradigm and you really go through the process, including what we talk now, detoxification, healing the scars of survival, and freeing the survival paradox, at least the introduction, then you got 70, 80 pages of protocols. And there is a big detox protocol, a very good detox chapter, because I took it from years and years, 20 years of doing detox, which I would change in the spring and the fall in the clinic. And Ruby helped me with this, and she's worked with me in the clinic for a long time. And my daughter, Lamachuni, edited it. And in it, there is a lemon olive oil recipe and how to do it. So it's all here and highly recommended. And then I can discuss with my team if they feel comfortable putting it out on the website. I think it's okay, but I'd rather people find it in a place where they actually also read and they have a whole understanding. So thank you for bringing it up. I want to thank everybody. We're going to meet late May. I have to finalize if it's going to be the 20th, the 20th, or the 29th. I'm not sure yet. We'll know shortly. And we'll talk about specifically how to let go of traumas. And my wish, at least, is to also prepare a video about it. And as part of it, and it was a big decision for me to allow the Zoom retreat, to offer it, as something that people can purchase. But it's really, I've gotten so much feedback about the benefit. And I've done this one day to thousands of people, literally. I've seen the power. So if you can take one day and just get it and go through the day, and then once you're done, then you can pick small parts that really resonate with you. The lying down, the healing lying down, certain meditation that you can get out of there. But allow yourself to take a day, only one day, and go through the process. You will feel different at the end of the day. So with this, thank you very much for joining me. And I look forward to seeing all of you soon again.